very good day to Dr. Hafiz and my fellow classmates. Our group consists of me, LEONG with matrix number GS69413 and SRIYANA with matrix number GS56660. We are going to present about the Adme, which is absorption, distribution, metabolism, and excretion process of methyl parathion. First of all, methyl parathion is an organophosphorus insecticide with widespread agricultural and veterinary applications. It is approved by the U.S. Environmental Protection Agency only for outdoor use on agricultural crops such as cotton. Parathion is extremely toxic from acute inhalations, oral and dermal exposures. The central nervous system, blood, respiratory system, eyes and skin are the organs most affected by acute exposure. It is classified by the EPA as a toxicity category 1 agent intended for non-systemic applications. Death will occur as a result of acute accidental exposure to high doses, and repeated exposure to small doses can cause marked inhibition of acetylcholinesterase. Thus, great care should be taken when handling methyl parathion. The concentration of methyl parathion at the site of action determines its toxicity. It depends on 4 stages, which are Adme, or we can call it toxicokinetic. Firstly, it will be absorbed into circulation, then distributed to various tissue, followed by metabolism or broken down, and lastly into excretion process either through urine or feces. Now I will present the Adme process one by one in detail. First, we investigate the absorption process. Parathion is effectively absorbed through any route. There are 3 routes of exposure, which are oral route through gastrointestinal tract, inhalation via lungs, and dermal exposure via skin. Oral exposure to methyl parathion, often known as ingestion, can result in severe disease, severe harm, and occasionally even death. The greatest potential for exposure of the general population to methyl parathion is by consumption of food containing residues from spray applications. This chemical can also be accidentally taken, or they may be purposely consumed by those who want to self-poisoning. When hands are not thoroughly cleaned before eating, oral contamination can also happen. Additionally, if methyl parathion is poorly stored in food containers, they could accidentally be ingested. Acute toxic effects, including rapidly fatal systemic poisoning, can result from ingestion of parathion. Since almost all the parathion was found in the urine, it can be said that GI tract quickly and completely absorbed parathion. For example, the half-life of parathion absorption in rats was 7.7 minutes. When parathion was administered orally to humans, which is 0.07 mg per kilogram, 70% of the parathion was excreted in the urine as p-nitrophenol. Human parathion poisoning is severe when the poison's GI tract absorption is delayed. There could be a number of causes of this delay. By inhalation, the tissue of nose, throat, and lungs can suffer significant harm from methyl parathion that enter the body. The risk of respiratory exposure is increased by the fast absorption of insecticide. The extremely small particles cause a higher risk of poisoning through respiratory exposure. Application of insecticide in small spaces, such as greenhouses, also increase the risk of inhalation exposure. Respiratory exposure cannot be separated completely from oral exposure because some inhaled material is likely to be retained on the mucous membrane of the upper respiratory tract. This material may be absorbed directly from this membrane or swallowed so that it becomes available for absorption. Dermal exposure, however, is a major source of exposure for workers directly involved in the manufacture, application, and cleanup of the chemicals, and for field workers. Laundry workers cleaning the clothing of such workers may also be exposed. Splashes and spills from handling parathion may result in dermal absorption. The length of exposure and body parts contaminated, such as skin or eyes, they all play a role in dangerous dermal absorptions. Dermal absorption is a slow process which stretches over days. Small children are more likely to come into contact with methyl parathion residue that may be present in soil and dust both outside and inside the home due to their larger surface area to body weight ratio, increased hand to mouth, hand to skin activity, and as well as playing habits. Limited diffusion across the dermis into the microcirculations is one factor that might have restricted bioavailability and contributed to the low concentration of methyl parathion in blood after dermal administration. Only about 50% of the dermally applied dose of methyl parathion will reach systemic circulations. This limited absorption will contribute to accumulation of a large fraction of the dose into a lipophilic compartment within the dermis. This slow diffusion accounts for both the delayed rise and prolonged elevation of systemic blood methyl parathion concentration. Methyl parathion has a large apparent volume of distribution from blood into peripheral tissue. Methyl parathion was detected in brain, fat tissues, and liver after administration. Brain and fat were designated as an independent peripheral compartments, whereas liver and blood were designated as the central compartment. It is also concentrated in gastric and intestinal walls, thyroid, spleen, and lungs. It can be easily crosses the blood-brain and other barriers because of its non-polar nature, and it accumulates to a lesser extent in the central nervous system. It is also concentrated in gastric and intestinal walls, thyroid, spleen, and lungs. It can be easily crosses the blood-brain and other barriers because of its non-polar nature, and it accumulates to a lesser extent in the central nervous system. Distribution of parathion to liver, fat, and brain occur rapidly, which is approximately 10 minutes. Over the next 8 hours, the amount of parathion in the brain decreases in parallel with the concentration in blood, whereas the concentration in fat remains constant. This observation suggests that lipophilic tissues such as brain and fat comprise a peripheral compartment for the distribution of methyl parathion and other organophosphorus insecticides. Also, binding to plasma protein may also contribute to the apparent volume of distribution for methyl parathion. The highest level of parathion was found in adipose tissue. It is first distributed to fat tissues, then redistributed to blood for metabolism. However, the movement of parathion from adipose tissue to blood is
In the normal neurotransmission, acetylcholine or in the normal neurotransmission, acetylcholine or ACH transmits nerve impulse across the junction between the nerve and the muscle, stimulating the muscle to move. After the accomplishment of the neurotransmission process, acetylcholinesterase enzyme or ACHE is released to break down or hydrolyze ACH, which ending the stimulation of the muscle. When a human body gets methylparathion, the compound is metabolized to form even more toxic chemical called methylpyroxine. The metabolization process undergo via oxidative desulfuration known as a phase 1 metabolism. In this reaction, the P double bond S linkage in the methylparathion is oxidized to form a P double bond O linkage in methylperoxone. Methylperoxone acts as ACHE inhibitor that inhibits the normal neurotransmission process. The ACHE inhibitor leads to an accumulation of ACH at nerve synapses and neuromuscular junctions that prevent ACH from hydrolyze. This resulting in overstimulation of cholinergic receptors throughout the body. The overstimulation of cholinergic receptors affects the central nervous system and cause several symptoms such as anxiety, seizures, skeletal nerve muscle junctions, and etc. While in the phase 2 metabolism, it involves a hydrolysis reaction of methylparathion to form lesser toxic compounds, namely para-nitrophenol or P-nitrophenol and other metabolites. These new compounds are also hydrophilic that can be methylparathion and methylperoxone cannot be eliminated in urination because both compounds are lipophilic or having a low water solubility. Hence, both compounds are metabolized to form a polar compound like P-nitrophenol, which is highly water soluble. Like in the phase 2 metabolism of methylparathion that produce P-nitrophenol, methylperoxone can also be metabolized to form same compound via enzymatic hydrolysis reaction. This reaction also form other polar compound of dimethylphosphate. P-nitrophenol and dimethylphosphate are quickly excreted in urine. Methylparathion is also found in human breast milk and can pass through the placenta and transfer to fetus. Conclusion: methylparathion can be absorbed into human body via oral, lung inhalation, and skin. It is then distributed in organs, mainly fat tissues, liver, and brain. Other fatty organs are gastric and intestinal wall, thyroid glands, and spleen. Methylparathion is metabolized via two phases, where phase 1 involves oxidative desulfuration, which produces a potent toxic compound, namely methylperoxone, that causes inhibition of ACHE, which affected CNS. While in phase 2 involves hydrolysis reaction that produces lesser toxic compounds, namely P-nitrophenols and its conjugates. Both compounds of methylparathion and methylperoxone are lipophilic and cannot be excreted in urination, so that they are metabolized to hydrophilic compounds such as P-nitrophenol and dimethylphosphate before excreted through urination. So that's all from us. Thank you.